Hi, my name is Olivia. I am a senior in college. I'm an undergrad. I'm studying Latin American studies and human rights. I originally came into Dion Dr. Samadian's office to see him as a dentist because I was graduating from my pediatric dentist, but also to get treatment for TMJ and the jaw pain that I was having. I had a lot of headaches and clicking in my jaw. It would I never had anything where my jaw couldn't close again, but it would just be sore or painful. Yeah, and I was also starting to grind my teeth as well. That was becoming an issue, which wasn't an issue before. It was a lot of headaches. I've been having issues with TMJ since I was about 13, which is when I first started receiving orthodontic care. And it was actually happened towards the end of my braces, like when I had my braces. And it was confusing because I was having this clicking and pain and soreness in my jaw, and I didn't really understand what was happening. But it sort of just meant that it would be sometimes difficult to chew, difficult to talk. Sometimes if I could overextend my mouth, and that was cool at one point when I was like 13, 14, but then it started to become painful. Yeah, and I think also just, even though it was not super noticeable, I was noticing that like I had cosmetic changes in my face and it felt like my face looked lopsided, and I didn't like that. But the daily complications were mostly pain in terms of headaches, tenseness, a bit of swelling, stuff. Unfortunately, the other dentists that I was seeing were not very helpful. They encouraged changing my diet, eating soft foods. They wanted me to stop chewing gum, which is something that I can't really do anymore, unfortunately, but they didn't offer any. They just told me to relax and that it would go away. When I came to see Dr. Samadian, I was really happy because it was the first time that a dentist had acknowledged the pain that I was having, and he showed me these diagrams and explained to me what was happening, which was really helpful because I could feel the symptoms and the situation that he was describing in my mouth. So that was like eliminated a lot for me in terms of like why I was feeling the pain and discomfort that I was having. And it was also really great because he actually had a solution, and it wasn't something that was going to be surgical or extremely invasive, but like just wearing these retainers at night, that was something that I was used to doing already and was going to actually help with my jaw pain. And I was like, that was really exciting for me because it was not something that I had a solution for a really long time. I really liked that Dr. Samadian explained what was going on and how the treatment would work, why it would be important, what problems it was going to solve in my mouth and with my jaw. Yeah, I found him to be very clear, and I also really like his team a lot, and I found his techs to be really sweet and accommodating, and everything was very transparent, and that's something that I appreciated because it also just made me feel better and feel like the symptoms that I was having were being acknowledged and recognized. I received some injections in my jaw to help with weaken the muscles, just helped a lot with pain management. And then I've also have a nighttime appliance that I wear, and I'm about a third of the way through 3-month treatment. And that involves a day appliance and night appliance. And then I'll wear the night appliance instead of a night retainer. Found the treatment experience to be really comfortable. Everything's been very clear. Yeah, and I've also just seen a lot of improvement in my health and in my pain level. I just don't have I don't have the same problems that I've had before. After the Botox treatment, I felt results within a week or so. Just I felt that the muscles on my face were smaller and just more relaxed. But then I would say after wearing the retainer, after wearing the day appliance and the night appliance, I noticed a change within probably 2 weeks. My jaw feels a lot better now compared to before treatment. I don't have the same clicking as I had before. I'm able to comfortably chew on both sides of my mouth. mouth. I've also noticed that my face has changed in a way that I really like and looks a lot less lopsided. I feel like my jaw is not able to open as much. It has like a smaller, more normal, more comfortable range of motion. So I really appreciate that. I would say that the biggest change TMJ treatment has had for me is honestly feeling more comfortable eating and feeling like just being able to use both sides of my mouth when I chew and not having like a clicking sound while I'm eating has been really nice because I just no longer kind of have the reminder that all the time that something's wrong. And also the reduction in pain from headaches has been really helpful. All the things I need to do. I would say if someone who's currently experiencing jaw pain, I'd say definitely it's possible that people might give you confusing answers and may not recognize the pain that you're experiencing, but don't stop looking and don't stop trying to find treatment. And there is treatment that exists that's more effective than just diet changes. So I really encourage you to go and find that because getting rid of the pain will have a significant improvement on your life. To someone skeptical of the effectiveness of TMJ treatment, I would just like to share that I found it to be effective. I guess TMJ pain is something that a lot of people ignore or medical professionals ignore and don't try to solve, but it is something that greatly improves the quality of life, improves like your oral health, improves the way that you are able to eat and talk and smile and your appearance. And it's not something that you should ignore. Something that actually medical professionals in the oral health field should be thinking about, especially when they're prescribing treatment, because I think that I experienced this negative side effect due to poor treatment. We need to do better about keeping it in mind with patients. Someone should choose Dion Health for their TMJ treatment care because the team is really kind. The process is very clear in terms of what you're going to expect. The team is very organized and communicative. If you have any issues with your appliance, like it breaking, they're very accommodating in replacing it. And they're also very clear about the treatment plan and why you need to get it. I felt very cared for as a patient, and I really appreciate and that the doctors are affirming of my situation and clear that they want to help me. I would say some of my wow moments were during the first appointment. I had gotten referred to this office because not specifically for TMJ treatment, more just for continued dentistry, but my pediatric dentist did know I was having this jaw issue, so they recommended for me to see Dr. Samadian. It was during the first appointment. I didn't have for a jaw consultation, but we were doing x-rays and I was opening and closing my jaw, and he was the first doctor who felt my jaw open and close. He felt the clicking and he was like, this is a really big issue. You're seeing us. He showed me this graph, this critical point where basically if I hadn't gotten treatment, the cartilage that covered one of my jaw bones could have snapped, which would have been a really big issue. And I guess by chance I had come in before I had gotten to that point, because it was the first time any medical professional had acknowledged that the pain and clicking, there was something wrong with it and it wasn't something that I just needed to ignore. And I was also just really excited because he had a very clear solution for me, which was just wearing these different retainers, which I was used to wearing and have been wearing since I was 13 years old, but just different ones. And that was really exciting. And then I think also definitely after the first month, I felt really happy because I could feel the changes in my mouth and in my health. It was really affirming. Yeah, I really like Dr. Samadian's team. I mostly go to the Orinda office, and all of the staff and assistants or dental techs are all really kind and helpful and transparent. They made me feel really cared for, were helpful and very accommodating in meeting my needs and also explaining the medical reasoning for everything that was happening, but then also being clear about when I would get my appliance, when I would have to come in for scans, when I would have to come in for other treatments. So that was all really great. The whole team has been really accommodating. Like I said before, I'm in college, so I'm not here all the time. I was still able to continue treatment even though I wasn't going to be like physically in person. Really accommodating about making sure that I had my appliances and everything that I needed before I went to school, that I would be able to come back in on my breaks to receive like more intensive treatment. I just really appreciated that they were able to work around my schedule, which is a bit more complicated than other people's because able to go into the office all the time. Yeah, and that was just really helpful, and his overall life helped my treatment a lot.